I'm Jennifer Brown. I'm the director of the CLL Center and Institute Physician at Dana-Farber Cancer Institute and the Worthington and Margaret Collette Professor of Medicine in the field of hematologic oncology at Harvard Medical School. I had the opportunity this ASH to present the updated results of the ALPINE study. ALPINE is a phase 3 randomized trial comparing the second-generation BTK inhibitor zanubrutinib to the first-generation inhibitor ibrutinib, head-to-head. The patient population were patients with at least one prior therapy, and in fact ended up being a population with a median of one prior therapy post-enrollment, and they had to be naive to prior BTK inhibitor treatment. Last year we presented 24-month follow-up, which demonstrated that the progression-free survival was improved by zanubrutinib compared to ibrutinib. And this year we update that with a median of 39-month follow-up across the study. It continues to be the case that more patients have discontinued ibrutinib for both progressive disease and adverse events than have discontinued zanubrutinib. And the updated PFS data showed that zanubrutinib has a 65% landmark 3-year PFS compared to 55% with ibrutinib, a very similar hazard ratio as we saw last year. We did multiple sensitivity analyses to confirm this as well, including one in which we only included progressions and deaths that occurred during active therapy, another in which we censored for new CLL therapies without progression, and another in which we censored for COVID deaths, all of which supported the primary analysis. In the pre-planned subgroup of 17 P-deleted patients, the effect was even larger, with 59% of patients progression-free on zanubrutinib compared to only 41% with ibrutinib. The safety and tolerability continues to be quite good with zanubrutinib. It's approximately balanced in terms of the risks of hypertension, infection with ibrutinib, but cardiac risks were substantially reduced. The risk of AFib was 6.8% with zanubrutinib compared to 16% with ibrutinib. There were no new cardiac deaths, so there have been none with zanubrutinib on the study versus 6 with ibrutinib, which is 1.9%. So overall, the results support the high efficacy of zanubrutinib, and it's actually the first study to show improved efficacy in a head-to-head comparison of BTK inhibitors, supporting the value of zanubrutinib for the therapy of CLL.